Today, we're diving into one of the most talked about and honestly most dreaded parts of the healthcare system: prior authorization. If you've ever worked in a provider's office, managed a patient case, or even been a patient yourself, you know exactly how frustrating it can be. So let's break it down together: what prior authorization really is, why it feels so painful, and most importantly, how we can make it easier. First things first, what is prior authorization? At its core, it's the process where a provider has to get approval from an insurance company before delivering a certain treatment, procedure, or medication. The idea, at least on paper, is to ensure that what's being prescribed is medically necessary and cost effective. Payers see it as a gatekeeper step, protecting against unnecessary costs or overuse. But for providers and patients, it often feels like another hurdle in an already complex system. Now let's talk about the pain points. Why does prior authorization create so much frustration? First, it's inconsistent. Every payer has their requirements, and even within the same payer, the rules may vary by plan. It's time consuming. Staff spend hours chasing down forms, making phone calls, and faxing paperwork. In fact, studies show that providers spend the equivalent of several full workdays every month just managing prior auths. It delays care. Patients often wait days or even weeks for approval, and in some cases, those delays mean worsening health or patients abandoning treatment altogether. And lastly, it feels unfair. Providers who know their patients best feel second guessed by insurers who may never see the patient face to face. So, while the intent might be to control costs, the experience often leads to burnout for providers and anxiety for patients. Here's the good news: there are ways to make prior authorization less painful for providers, for patients, and even for payers. First, equip providers with strong documentation. Most denials happen because of missing or incomplete information. Supplying offices with medical necessity templates, checklists, and sample letters gives them what they need to succeed the first time. Centralized support. Instead of every practice reinventing the wheel, patient access teams like ours at Walnut Hill Medical step in as an extension of the practice. We know the payer requirements, we know the processes, and we can handle the back and forth so the practice can stay focused on patient care. Be proactive with payers. Don't wait until denials pile up. By engaging with payers early, sharing clinical evidence, and clarifying policies, companies can shape smoother pathways and reduce unnecessary prior auth hurdles. And lastly, track and learn. Collect data on what's working and what isn't, which payers are denying most often, what documentation gets approvals fastest. Using these insights make each submission more efficient and builds a stronger case for long-term policy improvements. So, prior authorization may always be a part of our healthcare system, but it doesn't have to be the headache it is today. By planning ahead, supporting providers, using the right tools, and building payer relationships, we can turn a painful process into one that's a lot more manageable. Thanks for watching.